Hi everyone, good morning, good afternoon, good evening, wherever you are when you're watching this video, whatever time of the day. I just want to welcome everyone in this video of today. As you can see the topic, and welcome. My name is Zeti at Nashville, and I do videos about health and lifestyle and travel medicine and vaccination and basically here and there things that you need to know about healthcare in a nutshell, including trainings and where you can get the trainings from. And this evening I just want us to digest in our last video we talked about vaccination, COVID-19 vaccination. And today I would want us to focus on the side effect, which many people have really asked about, and I can see it's a concern, and people need to know if I have to get the shot, what is in there for me, or how will I feel, or is there going to be any effect on me, as there's so many things that is going around about the COVID vaccine, and given that it's a new disease and it's a pandemic and it's everybody's concern, I understand. And I just went down and looked up from medical journals, the current medical journals, on what side effects are being explained there, and I wanted to bring us to the audience so that we can have a sneak peek of what you might expect. You might. Mark my word, you might. Not everyone gets the side effects. But now, if you do, which one do you expect? Which one are adverse? And by adverse, I mean which ones are for you to get concerned about. And these side effects, they range. But we will just discuss the most common ones that people are having, so that in case you have any other one outside the box of what I have talked about, it is always good to consult your healthcare provider and get advised properly. Okay, so we'll just dig right into the video. Most of the common side effects are because it's a shot that you're being given. So basically, most, if not all, people will have pain at the site of injection. Yeah. There'll be pain, there'll be redness, or there'll be swelling around the site, the injection site. And this varies. There's and that people will have. And when you have pain at the site of injection, we are expecting it because, one, we are poking into your flesh, and two, this is a cold vaccine that is getting into your system, which is already warm. So it will take some bit of time for it to acclimatize and get to the normal body temperature for it to be able to, the pain to go away. Okay, so if you have that pain around your injection site, it should not be much of a concern because many people are having it. Okay, another side effect we're expecting can be fatigue. Fatigue is just feeling tiredness, feeling like you're not yourself, you're feeling tired, you just want to rest, you just want to sleep. There are people who will have headaches, and we have those who will have chills, you're shivering, you're feeling a lot of cold, and we have the range who will feel hotness of body, and some will even come up with fever, they'll feel feverish. Okay, we have body pains. There are people who will feel joint pains, just muscle aches, and some will even feel nausea. Yeah, and we also have the newest side effects that have been reported up until the 7th of August, the new side effects that have been reported according to WHO. We have the allergic skin rash. Okay, they call it allergic erythema. And there are also some concerns that are coming in. There's some few percentage of people who are complaining about swelling of the body, and when it's investigated, they find that it's the swelling of of the kidneys, and we call it glomerulonephritis. That is the swelling of the glomeruli, which is the place that filters urine into the system. So the general swelling of the kidney itself, and something called nephrotic syndrome, where someone also just swells generally, but the swelling reduces as the day goes by, and tomorrow in the morning you'll have the swelling again, and then as the day goes by the swelling goes down. So those are some of the other new coming in effect. And some also have swelling of the heart, which is called carditis, swelling of the heart. But overall, these new side effects, they wear out with time. But now the thing is that the WHO and other research centers are saying that the benefit outweighs the risk. Okay, so these are some of the things that will make you feel uneasy when the side effects will wear off. It's not something that will be permanent. It will not damage your heart permanently. It will not damage your kidneys permanently. It just brings up the inflammation. Okay, we are having all these inflammations, which is the swelling, because of the reaction that you are having to the vaccine. Okay, when you're inoculated, when you injected the vaccine, you will have an inflammatory process, because it is like a mini virus that has been injected in you. So definitely you will have those symptoms coming up. And when you get into any infection that comes in your system, there's always a fight with your white blood cells. And during that fight, there's inflammation, there's swelling. All the reactions come with swelling. Even when you bruise your hand, there's always a swelling that comes there because of that reaction of the skin and inside your body. When you get inoculated, it's usually that reaction that is trying to bring out, when you're trying to bring out the antibodies to be able to fight these mini virus that you've been inoculated, so that next time when you get the infection, you'll have the foot soldiers on ground to fight them, to fight the COVID, so that you'll not end up with the severe forms of COVID-19. Okay, so what do we do when we get these side effect? Okay, most of the time you will be explained this at the injection center, and they'll tell you if you have very severe headache or you feel a lot of pain, you can take medication. But we advise that if the pain and whatever it is that you're going through is bearable, you'd rather not take any medication, because it impairs the function of it impairs the whole process. It interferes with the whole process of the reaction and the formation of antibodies, because you're tempering it down to how it's supposed, the amount of antibodies that can be produced. So it is advised that you'd rather not take. But if you feel like you're outdone, you can just always take something to calm you down. Okay, so the normal management that you can do other than taking medication around the site of injection, the swelling we talked about, and the pain and the redness, you can use a cool washcloth and press on it just to relieve the pain and the swelling. And also the cool warm cloth will help the vaccine to disintegrate very well with the skin, and also to warm up so that the pain goes out faster. And for the headaches, you can take a lot of fluids. The flu-like symptoms, you can take a lot of fluids. You can eat a lot of fruits. They'll also help in boosting the immunity at the same time when they're also helping you with the side effects. And also the fatigue, you can as well drink a lot of water and take rest, which will also help you. So we usually consider, people will ask, so can I get the vaccine following each other? Okay, because of we talked about this vaccine, we have the ones that you'll have 2 shots, and we have the ones that you'll have only 1 shot. So we are expecting that this one for the 2 shots, the side effects that you had this time might be worse or less when you get it the next time. So you cannot just rely on someone who says that it worsened, or then the second shot he didn't have any symptoms. So everybody reacts differently. So expect your own package of reaction. Okay. Yeah. Basically, I think that's it for today. And thank you so much for watching. In case you have any question, kindly link it down in the comment section below. I'll be sure to respond to it. And those who have not subscribed, kindly hit the subscription bell and also the notification bell icon, so that when I upload a video, you're able to get it firsthand. Thank you very much, and God bless you. Have a nice day. Take care of yourself and take care of the world. Bye.